Welcome to the Street Dog Podcast, brought to you by the Street Dog Coalition. We are a national nonprofit providing free veterinary care and related services to pets of people experiencing or at risk of homelessness. I am your host, Daria Tavana, and I'm also the Director of Development at the Street Dog Coalition. And before I go any further, I want to introduce my fabulous co-host for today. I will let her say hello and introduce herself real quick. Go for it.
Hello, everyone. I'm Dr. Hilary Wheeler. I am the medical director for the Street Dog Coalition, as well as the volunteer team lead for the Bay Area team in Northern California. And I am thrilled to be here today.
Yay! Thank you, Hilary. So for those of you who are new to our podcast, you might see a cat flapping her tail on my lap. Both Hilary and I have cats on our laps today. Very on brand for us. So we'll see what kind of excitement comes out of these cats on our lap. But if you're new to our world, you know, or you rather, let me take that back. If you are new to our world, you may not know, but on this podcast, we explore the world of animal welfare through the eyes of experts, street dog vets, and volunteers. We share inspiring stories, provide updates on our advocacy work, and we give you an inside look at the challenges and rewards of working to improve the lives of animals belonging to people experiencing or at risk of homelessness. And as you can tell, I get very, very distracted and flustered whenever this beautiful cat is on my lap. So I'm going to try to tune her out. So if you're tuning in live on Facebook, it is great to have you here. Go ahead, drop an emoji in the comments, say hello, let us know where you're tuning in from. And as I always say, please do not hesitate to ask a question or leave a comment if you feel inspired to. I'm happy to share those questions and comments with my co-host, with our guest today. And of course, if you're listening on Spotify, Apple Podcasts, or YouTube, please make sure that you're following us on Facebook so that you can tune in live every episode and you can engage with us in real time, which is truly our favorite thing to do. So without any further ado, this is my drum roll. Today on our podcast, we have Dr. Bob Murtaugh, and I've been officially given the green light to call him Murt. So Murt graduated from the University of Minnesota's College of Veterinary Medicine. He completed his residency at the Ohio State University, and he became board certified in veterinary internal medicine in 1985. I love it. OG. His career includes faculty positions at Tufts University School of Veterinary Medicine, and also serving as, and also serving as hospital director for both the large and small animal teaching hospitals. He has also held positions at Dove Lewis Emergency Animal Hospital Group and VCA Animal Hospitals, where he served as a specialist medical director and regional medical director. Now in 2015, Murt, God, it's just so much fun to say, Murt joined Pathway Vet Alliance, which is now Thrive Pet Healthcare, as a partner and chief medical officer, contributing significantly to its growth from 15 to over 350 veterinary locations across 37 states, which is damn near all of them. Currently, Bob is the chair of veterinary medicine at the National Academies of Practice. He's an incredible person, and he's a huge supporter of the Street Dog Coalition. And he's also served as a mentor to our medical director and co-host today, Hilary Wheeler. So it's just so exciting to have you here on the podcast, Murt. I'm so glad that when I invited you, you jumped at the chance, and just thank you so much for joining us today.
Yeah, thanks, Daria. It's a pleasure to be here, and it's nice that you're hosting a Tufts alumni party with Dr. Wheeler. So very, very kind.
Exactly. I feel like we should have cocktails right now. We're all getting the game back together again.
There you go.
Oh, I love it. I love it.
Yes, for our community that does not know. So I went to Tufts Veterinary School, now Cummings School of Veterinary Medicine. And at the time, Dr. Murtaugh, who then fondly became known as Murt, was actually faculty and one of my professors. And I've had the pleasure of getting to reunite with him through Street Dog Coalition. So this is great. It's getting us all together and getting to chat about some of our favorite topics.
Yeah,
For sure.
I'm excited, and I know, Murt, you have so much passion, so many interests, and one of the nearest and dearest areas, or rather issues, that you mentioned wanting to kind of lean into and chat about on today's episode is the problems and barriers that exist in ensuring accessible veterinary care. So I'm curious to know, from your incredible background, from your various experiences, what are some of these key problems or barriers that exist in ensuring accessible veterinary care? And also, what kind of solutions have you come across, seen, or implemented?
Yeah, thanks, Daria. Well, I think, financial is one of them, and I think geographic is another, and then I think the overarching one in our profession right now is just the fact that there's, although it's not recognized by everybody, there's a shortage of providers, veterinarians, even in urban areas. Emergency clinics are facing challenges of staffing, and certainly 500 counties across the country that don't have veterinary services in an accessible location to people that have pets or other animals, and certainly the homeless population that you guys cater to is a critical element in that, and I'm thankful that I'm able to contribute to your cause. And John Geller, your founder, is a longtime friend and colleague of mine, and it's a great legacy that he's produced, and you guys are carrying on and growing it, and it's an amazing pursuit. So I think access to care. The number may not be exactly right, but 80% of pet owners, for example, may not have either access geographically or financially to even the basics. And so I think, as a profession and even as a society, I think we need to take a look at that. And I know Dr. Geller is working on an initiative which I think is quite interesting, which is, he's titled it Peticaid. So if you look at the Medicaid program, that if we devoted a few $1 billion to pet health care, which helps the human-animal bond and human well-being through that human-animal bond, that there'll actually be cost savings. It'll pay for itself. So let's see what happens with Peticaid 2030. I think that's an exciting proposition.
Yeah. And I think, that's what we need. We need the dreamers out there to spark the ideas of how can we change things and how can we shift our focus. And we always talk about wellness and preventative care. We know that applies to human medicine as well as veterinary medicine. And if we can do more to prevent disease, right? And we know the human-animal bond. We know not only are there the emotional benefits, but there are documented physiological benefits to having a relationship with an animal in your life. So I know, as veterinarians, we go into this field wanting to support that bond, and we often are not taught or really prepared for going into practice the frustration we have then seeing how inaccessible the care we provide is to so many people. And for me, that was a journey I had to take. And one big thing that led me to the Street Dog Coalition was seeing an organization that was allowing me to remove that transactional nature of providing care and to feel like I could actually do something and use my skill set to help more people who really didn't have that access. And, you mentioned Dr. Geller is a longtime friend, which we love, and absolutely none of us would be here without him. He's laid that foundation that we're now hoping to spread, grow, and, increase awareness. But I guess, one thing that I'm curious is, obviously through talking to him, getting to know about the Street Dog Coalition, how do you feel that's impacted you, and how do you feel it may be helping to address the issues of accessibility to veterinary care, especially for underserved populations of people? What drew you to Street Dog Coalition and becoming a supporter?
Well, I think initially it was the personal connection with John. I mean, it was back when it was, just him and going to cities and making a team happen, and to see where it's gone in the last 10 years is amazing. And I think access to care. I mean, I had an ill-fated run for president-elect of the AVMA this past year, and the whole premise of my campaign was around access to care. So I think, as you said, Hilary, the issues of, as a veterinarian, a practicing veterinarian, to meet, to be between wanting to provide and not being able to provide, whether, it's primarily financial, obviously, in the world of emergency critical care, which is where I've lived for most of my practicing career. But, I think as a profession, we need to take a hard look at how we can help to advocate on behalf of all pet owners, or all segments of the population that we deal with beyond even pets.
So. Yeah. I mean, I think, and that's kind of the Medicaid idea, is finding ways to subsidize that care. I mean, we know how expensive it is to operate a veterinary hospital, for example, and the overhead involved in that. And unfortunately, the way to cover those expenses is increasing prices. That's just a fact of life. And it is something, as a small business owner starting my own practice, I certainly had to learn and realize that that's the only way you can sustain that business and allow your team to continue providing care to your clients. But it can be a frustrating situation to be in when you really want to be able to help all people and their veterinary needs. And it's really not something that's sustainable to give free care to everyone that needs it. So finding ways to get creative. And I think we really do have to shift the perspective, in the world right now, of the importance of those ideas that you mentioned that can help increase our ability to do that.
Yeah, and that's kind of why I became active with the National Academies of Practice, which is 16 different healthcare organizations, all of which are oriented towards human medicine, except for the vet med group. But the issues are really the same. The access to care issues, the populations are the same. The shortage of providers, the fact that the human-animal bond is really should be a social determinant of health. Those are some of the things that I'm pushing on a sort of a national stage, if you will, with my human healthcare colleagues, and hope to make some inroads and take John Geller's ideas and put them to use. So
this has become the John Geller Fan Club podcast. Truly, it's amazing.
Well deserved.
Yeah, it's amazing. It's amazing to hear everyone's the influence John has had on everyone, and I'd like to kind of skip ahead with our questions here. I'll flip-flop my two questions, Hilary, since you mentioned being the chair of veterinary medicine at the National Academies of Practice. Maybe you can tell us a little bit about the One Health initiatives and the role that they play in providing accessible care to both pets and people in these care deserts that you mentioned. So I'd love to hear your insight as chair of veterinary medicine at the National Academies of Practice, within the work you do there, outside of the work you do there. But I know that these care deserts were something that you mentioned on our call. So what's the problem there, and what are some solutions? What are you guys working on?
Well, I think trying to harness on an advocacy level in Washington to get funding for both, whether it's related to human health or the human-animal bond as it relates to human health. But I was just on a call earlier this morning where a group from Auburn University, which includes the veterinary side of things. There's a care desert, you know, for human medicine that's an hour's drive outside of Auburn, Alabama, you know, and it has, there's no veterinarians in the town either, you know, so there's a lot of work to be done, whether it's on a local or national scale, to try to meet the basic needs. And this is one of the reasons I'm a strong advocate for telemedicine, because I think, you know, others may disagree with me, but, you know, Hilary's been around long enough. I've been around long enough that sometimes, you know, we were just talking before we came on the air here, Daria, your cat was vomiting. So, you know, maybe we could actually make a difference if you couldn't get to the vet because it's 50 miles away. Maybe we could do a telehealth call and give you something to start with at least, you know, and know where our limits are. Yeah. So I think, you know, human medicine, we can learn from them. The virtual sort of establishment of a patient relationship can be done safely and be done for the better of the people and pets. They're doing it in Canada. They've been doing it for the better part of a decade in Ontario with no issues, but yet our state and national organizations and organized veterinary medicine don't see the benefits. It's a scarcity mentality instead of trying protectionist, instead of trying to take care of the better good, you know. So I think these are some of the things that drive me. They drive me a little crazy, but they also drive me to try to do good things, you know. So
yeah, I think we're all, I mean, the field in general, and especially in the United States, there's such a high concern for liability, right? And that's, you know, that's fine to balance out, as Bob mentioned. Of course, we want to be able to do things in a safe manner and in a way that we're not causing harm, right? That do no harm. But we have to look at, it's not a black and white issue. It's something that there are shades of gray everywhere, and especially in these areas that are care deserts where it's just not reasonable or even available to people to bring their animal to a veterinarian, let alone to a specialist, you know, or an emergency critical care facility. We have to find ways that we can make that care accessible. And we certainly are seeing that a bit more in human medicine. And I always kind of look at veterinary medicine as being about a decade behind, maybe more, right? But behind the trends that we see in human health. So again, that sort of, I guess, brings us to the One Health perspective, you know, that we have to really be working together. And I know I'm kind of dipping into your questions here, Daria, by bringing that up, but that's how the podcast rolls. We just kind of go with it as we go. But I think that's one thing that I know you're doing a lot, Bob, with One Health groups and those initiatives, and maybe it would help the people tuning in today for them to understand a little bit about what does that mean. You know, I think One Health is a term thrown out there a lot, and really, what does it mean, especially in relationship to what we're talking about today?
Well, we've touched on the human-animal bond, which is a big part of it. But I mean, if you look at the scope of veterinary medicine, ranging from food safety to environmental issues and climate change and other things, that zoonotic disease, you know, there's opportunities to help across the population in this country and the world with regard to issues that are of importance to societies. And you know, I think the One Health term is sort of a veterinary term, but it does sort of cover those gamuts of things that are important to human health as well. And so the National Academies of Practice it has a strategic initiative to really address those issues on a national level through advocacy and interprofessional education and practice. And I think my intent is to make sure that veterinary medicine and the benefits that we bring as professionals with some of those areas of expertise, and also make sure that the human-animal bond on the pet side of veterinary medicine gets the attention and maybe the funding that it should, to at least provide basic care for pets and people,
Yeah.
Absolutely. And Hilary, I'm going to borrow some of your question here. So it's funny, Murt, you have so much experience and you're at the helm of so many projects. And for me, sometimes it's hard to keep track.
You guys forgot that I also took on the part-time job of a founding dean for a new vet school. So
Oh, in your
okay.
free
Now that you
time.
mentioned that, can you like tell us a little bit about that? I was going to ask you a question about being the chair of the coalition for veterinary professional associates. Tell us about.
Well, we
Go
can
ahead.
tackle both because they're both interrelated. Again, it's an issue of the fact that there are not enough veterinarians in this country, in the world for that matter. Again, taking a look at human health in the past 50 years, the development of the nurse practitioner and the physician assistant have greatly augmented the ability of delivery of human health care and addressing some of the access to care issues. So a group of us have formed what's called the Coalition for the Veterinary Professional Associate, which is essentially to try to create that mid-level provider in our profession for the reasons that we've been talking about, which is increased access to care. It's also an opportunity for mobility for our co-professionals on the technician level. And there's 10 or 11 new vet schools popping up, which is putting the Council on Education under a little bit of stress because of manpower issues. But there's going to be a new vet school, hopefully in Billings, Montana in 3 years. So
Wow.
stay tuned.
Yeah.
Wow.
And I mean, the location alone of these new veterinary schools is so critical as well. We know that, going to these schools, a lot of the students, even if they're not from that area, there may be an increased chance of them staying locally. And especially if we're closer to those areas where they don't have accessible veterinary care, that potentially can make a huge impact on one more step towards solving that problem and creating more opportunities for us to do what we're here to do and why we go into this field.
Yeah, so if you look at Montana, Wyoming, Idaho, the Dakotas, no vet schools. So there's a sort of a strategic and a personal reason for having interest for the reasons that you just mentioned, Hilary, is the geography and the lack of accessible veterinary services or people moving into the area because so I think I'm hopeful that we'll be able to address some of those geographic issues in the Mountain West, I guess it's called. So
yeah, that's exciting.
It is really exciting. And I know, Murt, that you have played a pivotal role in not only the organizations and the associations that you are actively a part of, but you've also advocated for a handful of other organizations. I remember whenever you and I touched base before the Thanksgiving holiday, I asked you, what do you want to talk about? And of course, in your humble fashion, you said, a bunch of other organizations and the work they're doing. Let's uplift them. Let's raise awareness about the work they're doing. And some of the ones that you mentioned are Let's Save the Strays International, Mission Rabies, which has vaccinated over 2 million dogs, an organization called, I believe, let me not butcher this, Amici Cannis USA, among other organizations. So of these three in particular, Amici, Let's Save the Strays, Mission Rabies, all of which I'm going to link to these organizations, including your website, Murt, in our show notes. I'm curious to know, maybe you can share with our listeners what makes these organizations unique and why these organizations, or even organizations that are similar to these organizations, like Let's Save the Strays, like Mission Rabies and Amici Cannis, why are they vital in this mission of creating more accessible veterinary care?
yeah, so those are all global organizations. So I mean, we were talking earlier about the One Health aspects. So Mission Rabies, for example, is international group that, as you mentioned, vaccinates street dogs across the world. But rabies is a problem, zoonotic problem in a large part of the developed and underdeveloped areas of the world. So, I think something like that resonates with veterinarians and with myself. Amici Cannis is a couple of U.S. veterinarians have established a clinic in Ecuador where they're modeling an approach to instead of putting dogs in shelters, let's make sure that they're spayed and neutered and back in the community. So it's kind of trap, neuter, release for canines in Ecuador. But it's the issue is that those are community pets. They're not individual pets. And so, and that's kind of what the Save the Strays organization is doing as well in the Southeast Asia area. And so these are all initiatives actually started by American veterinarians in many cases that have gone and provided these missions, and much similar to what John Geller has done for the homeless here in the States. And so these are things that resonate with me as an individual, and I'm grateful to have the opportunity to be on a couple of those advisory boards and help them along the way. And the Amici Cannis thing, you'll like this, Hilary. Tough students go down there and get exposed to high volume spay neuter and so forth, but they also see the outreach and the importance of being a part of the community, not just in the States but across the globe when it comes to being a full professional in veterinary medicine. So I think that's another sort of bonus, is the opportunity for students, young professionals in our industry to actually get those experiences and then build on it to something greater, just like John Geller's done with you guys, So,
I mean, for me, it's so great to see that our profession is moving towards giving students the opportunity to see the value and the importance of street medicine, for example, and even just going to those areas where we have to really face completely different issues than what we may be used to seeing in the United States. So for example, Ecuador, these are street dogs and the community cares for them. We just, as veterinarians, need to do what we can to support that connection they have, but do it in a safe manner. And so instead of, like you said, throwing them in shelters, spaying, neutering, vaccinating them so they're safe, there's not a public health issue, but they can return to the community. And we've had that philosophy with cats for years, right? But it's very outside of our realm to think of that with dogs. And I'm seeing at veterinary schools now, more and more of them are having either on-site low-cost clinics for communities that are not able to afford, the level of care that we usually see in private practice or even in academic. Right. And just getting out there into those types of opportunities. I mean, I will say one thing, just to give Tufts another shout out. I had the opportunity when I was a student, and this was a long time ago, that I got to go to the Navajo reservation and do a month there, working at a clinic that was essentially a free clinic for everyone living on the reservation, and seeing diseases that we rarely saw when we were in more of that academic bubble, and also doing a lot of these surgeries and procedures that you realize are so critical to the welfare of the animal and the people, and these communities are so interconnected. So again, it really does, when we talk about One Health, to me, that's what it is too, is we have to think outside the box, but we have to get these students exposed to that while they're still in that formative period of being in veterinary school, and hope that then they go out into practice and they too are able to have time to contribute some of their skills to helping these other communities. And really, we as employers too, we should be looking at, I always think about tech companies that encourage their employees to do a certain number of hours a year where they're paid to actually go do charitable work. I think that's another area where, as we see these new veterinary schools popping up and we see these programs starting to take hold, maybe that's something we also look at, is getting a system in place where veterinarians have the ability to spend time
Right.
providing more accessible veterinary care, and not, we know we're all kind of struggling with
Right.
the fact that we don't have enough professionals, right? So every veterinarian in practice is on that verge of burnout. We hear about that all the time. And I personally have felt like Street Dog Coalition for me helped offset the stress that I was experiencing in private practice by feeling like I could give back to the community and
Yeah.
do more.
Helps your own well-being, no question.
Yeah, exactly.
I think, I think I agree with everything you said. And, another example would be, hiring new doctors and creating a relationship with local shelters and stuff, where maybe a day a week or a day every other week, that part of their job is to be participatory for just the reasons you mentioned, as well as, the practice, being able to give back to the community and the individuals to feel good about that as well. So there's a lot of ways to do it that isn't necessarily going to negatively impact somebody's bottom line, so.
Yeah. I mean, and if anything, the hope would be it actually might improve it, because we're supporting the welfare of that veterinarian, the emotional health of them too. Right. And I know that for me, kind of refuels me for when I go back into practice and I'm in my day job, seeing patients. Right. It's my work outside of that oftentimes gives me a fresher perspective on what I'm doing, on a daily basis.
Guys see that in every new chapter of the Street Dog Coalition that you establish. You probably get those sort of feedback comments from people that it's rejuvenated them, or it allows them to develop some of that personal resiliency or whatever.
Yeah, absolutely. And they want to do it. I mean, that's something that our volunteers are the backbone of our organization. And really, I think people don't really realize that. You hear about Street Dog Coalition and what we're doing, but for me, getting to support those teams and actually having the daily interactions with them and seeing veterinarians who they're juggling, so just like you, they're juggling so many things, yet they're happily committing time to doing this work. And I just had one of our teams suggest that he found a facility that has an unused surgery suite. And he was saying that all of his volunteer DVMs in the area, they're all excited to start doing free spay neuter for all of the animals that they see at their Street Dog Coalition clinics. Wow. And doing that maybe once a month on a weekend when they're not at their day jobs. And they're all excited about it. No one's complaining about, using that free time to give back to the community. It's in fact something that's actually kind of giving them that recharge that they need, and really feeling like they're finding ways to help even more. It is amazing to see.
Yeah, it doesn't take a lot to make a difference for yourself and others, actually.
Yeah. Yeah.
And I'm so glad that you're both talking about burnout and about how you have felt more drawn to and pulled to your practice by lending your time, volunteering your time. And I'm curious to know, Murt, some parting words of wisdom from you. I'm going to put you on the spot here. So you guys both, I'm going to tell you, you make it look so easy to just have everything together, crush it professionally, volunteer your time. And I'm laughing because I know it's not easy. I know that you found this delicate balance after decades and decades of probably experiencing burnout, of probably taking on too much. So I'm curious to know, from your perspective, Murt, do you have some kind of, let's say someone is listening to this, and I'm sure we do have a lot of vet students listening to this, who might be in the middle of burnout, might be on the verge of burnout, but really somehow still want to volunteer their time and give more of themselves away to improve the lives of animals who may not have access to care. What kind of words of wisdom do you have? A mantra you usually tell your students? What advice do you have for someone listening who really wants to deepen their involvement, maybe with the Street Dog Coalition or another organization, but it's kind of maybe feeling the burn of burnout around the holidays?
Yeah, I think I'd start by just saying that there are a lot of things to celebrate every day and every practice, and I think we focus a lot of times on the one client that pissed us off, or the one that went bad, or whatever it is. But the reality is, maybe start with celebrating your successes, journaling some of that, sharing that in some morning huddles, or whatever, so that, and don't work in a bubble. I mean, if you're feeling the burn, talk with somebody, find a confidant, find somebody that you can relate to, that can relate to you, and be empathetic to yourself, and celebrate the fact that you are going to be, or you are a veterinarian, and you do wonderful things for people every day, and you can't take care of others till you take care of yourself. So I think self-care starting point.
Snaps for you, Murt. I'm not even a veterinarian, and I'm like taking mental note of this advice. That's fantastic advice, especially around the holidays. There's so much going on. It's so rough for people. I really appreciate that insight. And maybe, Hilary, I'll let you take us home by layering in any nuggets of wisdom, any vegan nuggets of wisdom, veggie nuggets of wisdom that you've got to layer into that incredible advice as well.
Yeah, I mean, honestly, as we're talking, I'm thinking our next podcast idea needs to be talking about veterinary social work and the importance of what that means and what benefits that can bring to the profession. But, really, one benefit of being in this field for decades is that we usually, those of us who started off in those early years, we saw the worst of the worst, right? And we kind of went into it not knowing any different, and put in the hours and did what we needed to do. And burnout wasn't even an option to consider at that time. But it's a real thing to think about the challenges we face. And Daria, you brought up the holidays. It is something we know systemically across our profession. We see a lot of difficult cases this time of year, and we face a higher rate of euthanasia in private practice and at emergency and critical care facilities. And we underestimate the impact that can have on our mental health. We're so busy helping everyone else. And as Murt said, we really have to make sure we're stopping and taking time to help ourselves. So I agree. I think reframing things to celebrate the wins, and that just may look like the one person bringing in their new puppy, and you just gave them information that they didn't have, and they're so grateful for you sharing that wisdom with them and supporting them and being a part of that experience. Every time I get a card of gratitude from a client, I keep it in a drawer. And I had a colleague years ago that called it the "I don't suck" drawer.
I love that.
So, whatever you choose to call it, honestly, go back and look at those cards,
pull them out,
those emails, pull them out. I mean, take a moment, celebrate it, and remember that those are always 10 times more important than the one bad Yelp review, right? The keyboard warriors that are behind the scenes. We instead need to
keyboard warriors. I love that.
I mean, we see it every day. We need to shift our focus to the many, many people that do thank us and appreciate us. And I always like to coin, the using our superpowers for good. That's really what we're doing as veterinarians every day. And we have to recognize that and appreciate ourselves as well as our colleagues.
So well said. Yeah. Go ahead, Murt. Sorry, what were you going to say?
I was just agreeing with Hilary. That was wisdom.
That's fantastic. That's fantastic. Keyboard warriors. It's amazing. It's like we always hear the negative voices the loudest and the longest, because they just I feel like they echo the most in our minds. But different podcast episode for a different day, because I could talk about that forever.
Oh yeah.
But I just wanted to thank you both so much for joining me today. I want to thank our listeners. We have our incredible supporter, John Mark, who like never misses an episode. He's tuned in live. And of course, he has said he wants to see the Street Dog Coalition get as big as the American Red Cross. You know what? I think we can do that. I think we can do that with support from our audience, from our donors, our volunteers, our incredible staff members, people like John Mark, who I love so much. And of course, Murt, with you, fully supporting all the work that we do, helping us increase our impact, helping us get our message out there, and just helping us take care of more animals who oftentimes would not receive care otherwise. It just means the world to me. It means the world to our listeners. And I know that, both you and Hilary continue to usher in these newer generations, the next generation of veterinarians. And it's just beautiful to watch happen. It's beautiful to see folks like you surrender your time and your energy for a bigger mission to help as many pets and people as possible. So thank you both so much for taking the time to join me today. Hilary, love having you as a host, the hostess with the mostest.
Right.
You treated our listeners to a little bit less of my voice today. That's okay. No, really. Thank you, Murt. Thanks for all your support. I would love to get you back on the pod sometime. You are just such a wealth of information. It's so much fun to have around. And Hilary, thank you too. That's it. I'm gonna get this cat off my lap. For those of you who have not seen my cat before, I just need you to see how adorable this cat is.
Beautiful cat.
She's like, put me down. Yes, my friend jokingly calls her the dish rag.
This moment of mental health support brought to you by, what's your cat's name?
This one is Norma Jean.
Norma Jean.
Thank you, Norma I'm gonna let her go because she.
I already feel my blood pressure dropping.
Oh yeah. She likes to suck the blood, the high blood pressure out of you, and then increases her own blood pressure and runs away screaming. So, all right, guys, thank you so much. Thank you again. Really appreciate it. Until next time, I'm sure I'll be talking to you both soon. Thank you.
You, Daria.
Thank you. Take care.
Bye.